I'd like to welcome Dr. Asare Christian. Thank you so much for being here this afternoon.
All right, thank you everyone. Welcome to Big October 2021 Wellness Challenge. I'm excited you're here and I hope you've had a great experience learning how to take care of yourself and becoming the healthiest person possible. So today I'll be talking to you about spasticity. But before I do, I have to share my screen with you here. One moment. Let's get this up here. All right, so I'm sure hopefully everybody can see my screen now. My name is Dr. Asare Christian. I'm a physical medicine and rehabilitation specialist, and I am also the medical director and founder of Ether Medicine. And we are a rehab and pain management practice in Wayne, Pennsylvania. I'm very happy to be here to take you through this presentation. There will be another section after this where you can have the opportunity to ask questions. So this will be a live question and answering session that after this we can get to answer any questions you have. Alternatively, as we go through the presentation, if you have specific questions, you can type it into the question box. And I believe our coordinators here can collect all that information and we can get to answer those for you as well. So again, thanks so much for being here. I'm excited for this journey for you. This has been great, even for me as a physician. I've learned so much from this presentation. So hopefully you learn more about spasticity. And I think this is something that most of you may be familiar with. Spasticity is something that affects individuals with MS and also even other individuals with neurological disease state. So hopefully this will be focused enough to give you as a patient some knowledge that can help you with your own management. And I know we have things that doctors can do for us. We have things that medications can do for us, but basically provide some education for you as a patient to be able to help with that whole paradigm of managing your spasticity. All right. So here, let's talk about spasticity. So what is spasticity? And I think this is a medical definition that I'm going to be going through, but as a patient, you have an experience of what spasticity is. And I think that experience is more relevant than the definition, because the definition for us as clinicians gives us a place to start to understand, to study, but you have a sense of what it is. It's basically tightness and spasms of muscles. So this is something that we know affects a lot of MS patients, about 80%. And when we're talking about treatment of spasticity, the goal is to reduce the tone as well as improve your function. So we want to take care of the spasms and also making sure that it does improve your functions. There are some treatment options we have with medications. Maybe some of you may be familiar with some of these medicines. So we have baclofen, we have tizanidine or Zanaflex, and there is also dantrolene and other medicines that we can use. There is also baclofen pumps that if none of the medicines have worked so well for you, that is an option as well. And then this is some information, some evidence from the American Academy of Neurology talking about the use of botulinum toxin or Botox or Dysport or Xeomin, any of those things to also help with treatment of spasticity. And again, from a non-pharmacological standpoint, some of the things you've been talking about in your studies, physical therapy, exercise, and other modalities. So this is basically a simple summary of what I'll be talking about. And hopefully all of this will make sense at the end of the presentation. So when we look at who is affected with spasticity, so this is just putting it into context for you. So not just MS, as I already mentioned. So MS patient population is about 84%. Cerebral palsy, this is something that also occurs in individuals with spinal cord, stroke, and even brain injury. And all of that relates to the same pathology, which is some lesion within the spinal cord or within the brain, which is consistent when you have MS. This pathology is consistent with MS, CP, and all of these other disease states. But looking at this slide, MS people do have a lot of problems with spasticity. And I have a lot of patients who have this problem and trying to get a good treatment makes a huge difference in terms of their function. All right. So now let's talk about definition. Definition from the doctor's side of things, or definition from physical therapists and other people. So spasticity is a motor disorder that is characterized by velocity-dependent increase in the muscle tone with exaggerated tendon jerks resulting from hyperexcitability of the stretch reflex as one component of the upper motor neuron. Too many words in here, but basically the concept I want you to get from here is this idea of velocity dependent. So velocity dependent means when we change how fast we move in things. So people can have spasticity in their arms. When you go slow, you can have a specific type of tightness. And then when you try to go fast, it actually changes. So when you change the velocity, there's increase in the tone. So that's what we mean by velocity dependent increase. And all of this is as a result of hyperexcitability of this reflex that controls your muscles. So basically within your spinal cord and your brain, you have this area called the anterior horn cell that controls your motor function, like how you move. And you have information from the brain that goes and helps you to control those smoothly. When you have MS or when you have spinal cord injury and you have a lesion within that side of the brain or within that side of the spinal cord, that process is not the same anymore. So basically you have brake systems that allows you to move very slowly, very comfortably, smoothly. But then when you have MS, that brake system is not there anymore. So there's jerking, there is tightness, there's all of these things. And basically that's all what this means, okay, in simple terms. But you as a patient, what you experience from spasticity is tightness, pain, stiffness, inability to stand or sit. And the other thing that I also want to clarify for individuals with the concept of spasticity is that spasticity is actually part of something we call the upper motor neuron syndrome. So it's not just the tightness. So the tightness is what we call positive signs. So there's positive signs with spasticity. There's clonus, there is tightness, there is other things like that. And then there is also negative symptoms that sometimes patients don't think about or it's not talked about a lot. So the negative symptoms from spasticity could be discoordination, weakness. So sometimes when you actually have spasticity, you have weakness. And this is why we have to be very careful when we are treating spasticity, because there are some benefit to spasticity that when we, because of stiffness in your leg, maybe it makes it easier for you to stand, it makes it easier for you to transfer. And when we're treating your spasticity and we take away that tone because we did an injection or we gave you medicine, that may potentially even make you weaker, and it may impact your ability to do that function which the spasticity did help you with. So it's all about understanding what this is about and how we can really use that to help patients manage symptoms. So here is the treatment options when we're talking about treatment. And most of you may be familiar with some of this stuff. So this is not new concept. So physical therapy, occupational therapy is very important. Stretching, exercising, yoga, all of those things that you've been learning about, all of that plays a role. And those things can be things that you can incorporate into your management of spasticity. We can also use medication. So I talked about baclofen, tizanidine or Zanaflex, dantrolene, there is diazepam, there's other medicines that we can use. And then we also have chemodenivation, which is botulinum toxin treatment. So this is where there is injections with either Botox, Dysport, Xeomin, any of those. And then there is also chemoneurolysis. So this is where we use actually a lot of times phenol alcohol. It's not so much in practice anymore, but that's something we can also use to treat spasticity. And if all of that is not working, or if you have a situation where your spasticity does not respond to the medicines or any of that modalities up there, then we go into intrathecal drug delivery. This is talking about baclofen pump. And then sometimes we may have to do surgery. So this is a whole paradigm, and you have to combine things in combination. Sometimes you may have to do chemodenivation with oral medicines as well as physical therapy. Sometimes you may have to do chemolysis. So it's not just one solution to addressing your spasticity. It's a function of individually, what are your goals? How bad is your spasticity? How is it implicating your function? And then looking at the side effect profile of this interventions and making sure that that works for you. Because the other problem we have is, even though we have these medicines that are really good for treating spasticity, they actually also cause weakness or sedation. And you already, have an MS, you have fatigue, you have weakness. And So we have to really figure out what is the best approach to managing your spasticity without causing a lot of side effect problems. So here, physical therapy, occupational therapy, we know those don't have any side effect, okay? Of course, there's always some risk with every intervention, but those are very limited. Chemodenervation, which is using botulinum toxin treatment for spasticity, that is something that works well when you have a focal spasticity, meaning a spasticity that just affects one side of your body or affects one side of your leg. Because when you take medicines for spasticity to treat a spasticity in your upper extremity or in your arm, the medicine is not just working on your arm, it's working on your whole body. So it's actually causing weakness in everywhere else. So in areas where you have a focal spasticity, the recommended approach or the best treatment option is to explore chemodenervation, where you just get the treatment there and you don't have to take a medicine that affects your whole body. And I can get into a little bit of this as we go through the presentation. Wonderful. All right, so this is a big concept that I want you to get from this presentation, okay? And I think as I'm talking through this, some of this ideas, spasticity, the meaning, how we measure all of that, it helps us clinicians to be able to make sense and objectively help with treatment. But this is something that I want you as a patient to have something that you actually knows and that empowers you with how you manage spasticity. So spasticity get worse with nauseous stimuli. This is a big point. What does that mean? What is a nauseous stimuli? So nauseous stimuli is anything that your body perceives as painful, okay? So you have your physiology and you have interactions with the environment, and specific things can be perceived as painful. And in the normal state, without MS, without any lesions within the brain or spinal cord injury, when you have those type of interactions, your body readjusts itself, okay? But when you have MS or when you have spasticity, that nervous system interaction with the environment is not as well as it's supposed to be. So any nauseous stimuli, it could be stress, it could be the fact that you didn't sleep very well, and maybe some of you can even relate to this idea of, when does my spasticity get worse? Right? So if somebody says something to you that really got you upset, that can actually increase your spasticity. So one of the most common things specifically for this patient population is bowel and bladder. So when you have spasticity or things are getting worse, are you having a UTI? UTI will make your spasticity worse. Having constipation can make your spasticity worse. Having a skin breakdown, which is all of those are what we call nauseous stimuli. Anything that your body perceives as painful or not a desired state will cause spasticity. Even tight clothing, if something is too tight on you, it can increase your spasticity. Temperature changes, cold, spasticity get a little tight. Things get a little tight in general with cold temperature. So maybe some of you may relate to this idea of having more tone or having more spasms when it gets cold. Thoughts, toxins, trauma, medications. There's actually specific medications that can actually increase your spasticity. And I use the concept of thought, meaning stress state. So when you're in a state where you're stressed, you're worried about something. I had a patient who recently lost a family member, and just that stress of dealing with the loss led to significant increase in his spasticity, okay? Toxins, some of the things that we eat, some of the things that we put in our body, all of those things can increase spasticity. We talk about trauma, anything happening that's changing your current state may also influence spasticity. And then medications. One of the things that, specifically for you to think about is that sometimes when you're taking muscle relaxants for your spasticity, for example, baclofen, that when you don't take it on the exact time, some of you, if you don't take it exactly at the same time, your spasticity actually get worse. And what is happening is that it's not the, so what is happening is that when you're taking muscle relaxants, or if you're on oral anti-spastic medications, after a certain time frame, if you've been on there for a long time, your body built tolerance to the medicine. So what is happening is when you don't take it, there's a little bit of withdrawal. Okay, there's some withdrawal symptoms. And this is something that your body is going to perceive as nauseous stimuli. And that can actually increase your spasticity. So think about all of those things and try to check, what is going on when my spasticity get worse. The simple things: look at your skin, make sure you don't have any skin breakdown. Look at what else have gone on within your last 24 hours, 48 hours. Did something stress you out? And using some of the skill sets that we've taught you through this processes to kind of help you manage it, because we know the medications do help, but there's limitations to what the medicines can do for us. So that's why we think it's important for you to have this knowledge to help you with how you manage spasticity, okay? And when it comes to treating spasticity, it's all about goal setting. Why do we have to treat spasticity? There has to be a rationale for it, okay? So we treat spasticity when it's interfering with your daily activity, it's causing pain, it's hard for you to put on clothing. So people that have very severe spasticity, it's even hard for them to open their arms, so putting on a shirt could be difficult. So we only treat when it's implicating your function, okay? And we also know that if we don't treat spasticity, actually when you have spasticity, it takes you even more energy to work. So you already have fatigue. So there's all of these things that we have to take into consideration as a person with MS to figure out how do we set clear goals on what you want to achieve, okay? So we talk about this idea of meaningful, smart, realistic goals. So even treating spasticity, there's a limit to what treatment can do, right? Because as I talked to you about, there is a positive signs and there's a negative sign. So when we're treating spasticity, we're giving you baclofen, we're giving you Xanaflex, we're doing all of those things. They do help with the positive signs. They don't address any of the negative signs with discoordination, weakness, any of those things. And this is where it's important to have a holistic treatment approach, where you have the treatment, but then you have treatment that focus on the positive signs of spasticity. And then you also do something else that helps with the negative signs, which is exercise and strengthening muscles and all of those things. And some of the benefit of spasticity, I think I talked about, being able to use spasticity to help you transfer. It actually also help even prevent DVTs because it's contracting your muscles to allow blood to flow. It even helps with bone with osteoporosis, because when your muscles are flaccid or you don't have any tone, you don't have any weight bearing activity that actually can increase your bone health. So we have to have a meaningful and realistic treatment. Spasticity treatment sometimes may help with your mobility, but it's not going to reverse the weakness you have. And I think that's something we have to get clear on. Sometimes patients will say, well, when I treat my spasticity, I want to be able to treat my spasticity so I can walk more. It may help, but there's limitations. So this is why you have to get very clear. We have to look at support systems. What kind of resources do you need? And one of the things that I've seen, and it's kind of unfortunate, is sometimes treating spasticity with Botox or Dysport or Xeomin, and then a patient doesn't have the ability to get to physical therapy. If we don't get you there to continue with the stretching, continue with the strengthening, we'd lose a lot of the benefit from the treatment with botulinum toxin. So it's very, very important. We also want to understand, what is causing your spasticity? How long has it been there? Where is this specifically? Is it in your arm? Is it in your legs? Is it in your hands? Is it in your fingers? Is it in your neck? Looking at other things such as your cognitive status, because the other thing that happens, as I talked about, is in an attempt to treat spasticity, the medicines and all these other things can have side effects. So we want to figure out what is the best treatment option that works for you, okay? So if one of your friends had to use baclofen, it doesn't mean that baclofen may be the right thing for you, okay? Because sometimes I've seen patients where we're trying to treat their spasticity, and in the process, because sometimes individuals with MS may have some bladder issues. So we were trying to treat the patient's spasticity, and we give them baclofen, and they actually end up having more incontinence because now we're also relaxing their bladder muscle. So it is very important to have very individual approach. And this is why it's important to see somebody, a clinician or team that understands what's going on with you. And then come into what are the goals. This is something that we also have to figure out, how much can your family do for you? How much can you do for yourself? and then being realistic about what spasticity treatment can do, okay? Because there is limitations, and you may not reverse so much the negative side of the negative signs of spasticity, which is something that you have to do exercise and stretching and all of those things. So this is why this is very important for you to take a holistic approach. All right, so here is a slide talking about the treatment paradigm. So we have different ways of treating spasticity. And again, the concepts are repetition, repetition, so you get a sense of what's going on. So we treat based on where if the spasticity is focal or it's localized to just one body part, okay? Is it regional? Is it affecting multiple areas? Is it your whole body, your left, your lower extremities, your upper extremities? Is it widespread? Is it up and down in your back, in your neck, all of those places? And understanding what type of spasticity you have helps with treatment paradigm, okay? So when you have focal spasticity, something that's just localized to one side of your body, it helps to just do botulinum toxin. That's the best treatment. This way you're not taking a medicine that's going into your body to relax all the muscles in your body, including your bladder, as I talked about. So this is where botulinum toxin could be a good option for treating focal spasticity. Regional, this is where you can also use either medicine, because if you have spasticity in your legs and upper extremities and lower extremities, we have to figure out what is the best way to do it, because even if you're trying to get botulinum toxin treatment, they don't have enough to inject everywhere else. So this is where the combination of treatment with the botulinum toxin as well as physical therapy, and then obviously avoiding and looking at the nauseous stimuli, the things I talked about that you can control, okay? Making sure that you're not in a state that is so stressful. You're not having a UTI. So trying to eliminate some of those things. Am I withdrawing from medications, okay? So the goal is not to add more medicines when you have increased spasticity, but really trying to understand what else is going on that could be complicating or that could be adding to the increased spasticity that's going on, okay? So a lot of investigation that gives you some power as a patient. And I know you've got a lot of skill sets from this presentations with meditation, mindfulness, exercising, irrespective of what level you are. You can sit and exercise, you can stretch, you've got tons of those things. And those goes a long way to help with management. And then sometimes we can also even explore if it's if it's affecting a huge side of your body, like bilateral lower extremities. This is where maybe intrathecal drug delivery, such as baclofen pump, can make a difference. And again, this becomes setting goals with your physician, your clinician, your team, your physical therapist, and everybody is on the same page to try to make sure that this is the right treatment for you, because these treatments do have side effect. So we want to make sure that everything is done in the right way and done safely. All right. Why do we treat spasticity, or when do we treat it? I think I talked about this before. When it's becoming something that's implicating your function, it's interfering with your positioning. Sometimes individuals can't even sit in the chair because there is so much spasticity that's getting them out of the chair, or even having their legs bent all the way back, and it's causing skin breakdown. We want to do this to improve active and passive range of motion, and then even helping with caregiver assistance. So sometimes your muscles are so tight that your caregivers who are helping with your bathing, some of those things, it can become an issue. I have a patient who has very tight spasticity in his thighs, and his leg is all closed up. So the goal is we are able to do the treatment, so then it's easier for caregivers to help with bathing and all of those activities. So this is when we treat spasticity. All right, let's see here. All right, so I think I am close to the end of my slide here. This is my summary slide. We are coming to the end of this presentation. And as I talked about, we know that this is something that affects a lot of individuals with MS. Not everybody will have it. And the other issue with spasticity is that it has no relationship with the level of your lesion, right? So I have a patient who recently got worse spasticity and there's no new lesions, and he, he's baffled, like, why am I having so much tightness? Why, and everything else is new. So we know that it doesn't correlate with your lesion status or how bad things have got with the spinal cord, because all the nauseous stimuli out there, he lost somebody in his family, and that was playing a role in that process. Okay, so the issue or the solution there is not to go add more baclofen or to add more medicines or more stuff, but really addressing the underlying causes, getting psychological help with grief, getting other people to talk to help. And that is what has made a difference for him. There is times where every once in a while you may have to increase your dose up and down to help you manage what's going on. But the most important thing is, let's get rid of the nauseous stimuli. Why is this happening? Okay, and then it also varies. So sometimes with time, there's times where I have patients where they're doing so well, their spasticity is better, and then weather changes, things comes up, and then things got worse. So everybody will have a very different clinical presentations. All right, and the goal of treatment when we're talking about spasticity is to really reduce the tone and function. It's all about function. How do we get you to be able to sit comfortably in a chair? How do we get you to be able to get up and sit up and walk to your kitchen and do the things you want to do without spasticity tripping you, or without you tripping because your legs are so tight, or you have clonus is bouncing off from the floor, and that's implicating your gait. Okay, so that is the goal. So sometimes people will think that, when I treat my spasticity, I'm going to have motor return, or like ability to do more with my muscles. Not necessarily. That becomes the function of exercise and strengthening the muscle. That's a totally different thing. So treatment, we have to get clear on what it's able to do for you. We have different ways we treat. First, isolating the nauseous stimuli, the nauseous stimuli, the nauseous stimuli. I want that to sink in for you because that gives you some control. And then we have medications. Baclofen, Xanaflex, dantrolene. Sometimes we can use Valium, and all of these things are things that you have to discuss with your neurologist or your physiatrist or your clinician, so then they have a better understanding of what your specific needs are. Because all these medicines have some other side effects that we have to think about. For example, if you have liver problems, it's not a good idea to put you on Xanaflex. We have to figure out how we work that out. We also have to think about the potential side effects. So a lot of individuals have fatigue with MS. And a lot of time, the secondary fatigue is coming from medications. All these medications make you tired. They relax muscles. So when muscles are relaxed, you can't move as much, okay? And you already don't have the energy to move. So it's really something that it requires a clear goal, and also understanding how these medicines affect your overall health and all of those things. And maybe even, sometimes because it relaxes you, this may be an option for nighttime. So maybe nighttime, sometimes we increase the dose so you can sleep better. So spasticity is not getting in your way of trying to sleep at nighttime. I talk about baclofen pumps. This is an option if none of the above stuff has really been able to help with that. And if you just have focal spasticity, something that is just affecting one side of your body, then it's great to do botulinum toxin. And then obviously physical therapy, exercise, some of these things are the things that goes a long way. So thank you for your attention to this presentation. This is the end of my presentation. And I also have had a few wellness classes out there. So I did a class on exercise and MS. So you already have had some practical experience with exercise and MS, and my presentation talks about some of the benefits of exercise or the science behind it. I also talked about something called the relaxation response, which is the basis of meditation, the basis of mindfulness, and what is actually happening when you meditate or manage your stress. There's things that you're activating in your physiology that helps manage all of those things. So go check those out. And I think those are going to be on the website for some time. I also talked about non-pharmacological management of pain. So basically some ways to manage your pain without a pill. And again, some of you are already taking enough pills, and we know the pills have limitations. So the idea is to give you some strategies there. So check those out. And now I believe we're going to be moving into the live Q&A. So if you're around, you may have to, I think, click on the next link And then hopefully we can meet you there and go from there. And I'm looking forward to answering any questions for you. Thank you very much.
Yes, I want to thank you, and everybody can just go back to their homepage and featured sessions are up next. You'll see the next class, and you can just hit join session, and we will see you there in a few minutes. Thank you so much.